Today I will be assessing Miles. He is a patient of mine coming in here for had his wisdom tooth taken out on Thursday. Is having increasing pain and tenderness and complaints of bleeding. His heart rate is 68 at this time. Temperature is a febrile at 99.0. His blood pressure is approximately or is 131 over 78. His respiration rate is 16. His pulse ox is 100%. He states his pain is an 8 out of 10 at this time. Does not have any other complaints at this time, and my assessment will continue. Knock, knock.
Yes.
Hi. I'm Nicole. Be your nurse today.
Hi.
What's your name?
Miles Davis.
Okay. What brings you in today, Miles?
I had my wisdom teeth taken out and they still hurt.
When did you have your wisdom teeth taken out?
Last Thursday.
Thursday. When you mean hurt, did they hurt worse than they did when you first happened, or does it hurt worse?
Worse.
No. What does it feel like?
Feels like somebody ripped my wisdom teeth out of my face and it still hurts.
Okay. Are you noticing any swelling?
Too much. A lot of blood loss. I'm still bleeding. They said I shouldn't be bleeding 24 hours.
So you pulling clots out?
Yes.
How many a day would you say?
3.
3? Are you using the gauze and holding pressure?
Yes.
Do you take any medications that would make you bleed more, like aspirin, Coumadin?
I'm only taking my medications.
Okay. Have you eaten anything that's abnormal? When did it just all of a sudden start hurting, or did it just gradually start hurting?
It gradually started hurting.
Okay. Did they give you any pain medications?
Yes.
Is that helping it at all?
Yes.
What are you taking?
Norco.
How often?
As needed.
What?
Every 5 hours.
5 hours. When was the last time you took it?
5 hours ago.
Okay, so you're due for one. If you had to rate the pain, 0 to 10, 10 being the worst pain in your life.
8.25.
0.25. Okay. So are you nauseous? Anything else going on with this?
No.
No.
Just I don't think it still should be bleeding this
Yeah.
long after the surgery.
Okay. You notice any fevers?
No.
Have you ever had oral surgery before?
No.
Alright, does the pain radiate anywhere? Does it go
It's pretty much in this region here.
just right here? Does it travel anywhere?
Correct.
Haven't vomited?
No.
So what brings you in right now today? Did you call your physician? Did you call your dentist?
They are unavailable.
They're unavailable. Closed.
Correct.
Right.
Columbus Day.
Veterans Day.
Veterans Day, Columbus Day. One of the days.
Okay. So let's talk about your past medical history. What other illnesses do you have going on, and what have you had in your past?
I get migraines.
Okay. How often?
Once a week, if maybe every 2 weeks.
One time a week. Okay. Do you have any vomiting?
No.
Okay. Have you had any other illnesses?
Yes.
What?
I have bile reflux disease.
Okay. How long have you had that? When was that diagnosed?
About 5 years ago.
Okay. Have you ever been hospitalized? Had any x-rays?
No.
Any procedures other than the oral surgery today?
No.
Or this week?
No.
Okay. Any CAT scans with the migraines?
No.
MRI? No. Okay. So the only surgery was last Thursday. No hernias, anything like that.
No.
So what medications are you prescribed? You're prescribed the Norco.
Norco,
Did you
just
bring
for
those
the
today?
just for the pain, and then I take Nexium, Omeprazole,
Omeprazole. Okay.
also known as.
Omeprazole.
I take 1 capsule a day.
Okay.
In the morning.
How many milligrams is that? 20 milligrams?
Yes. Okay. And then I take amitriptyline for migraines. 20 milligrams a night before bed.
Okay. Take all those today or?
I take this one in the morning and this one at night.
Okay. What do you take else for? Anything else for the migraines?
No.
Like Tylenol, ibuprofen?
No, no.
Okay. What allergies do you have?
I do not have any.
No allergies? Okay. Have you ever smoked?
Yes.
Have you still smoke?
No.
When did you quit?
About a year and a half ago.
How long did you smoke for?
About 3 years.
3 years.
On and off.
Do you use any other tobacco products?
Yes.
What tobacco products do you use?
Skull.
Chewing tobacco?
Correct.
Do you drink alcohol?
Occasionally.
Okay.
Recreationally.
How often would you say?
Lately, maybe once every month, 2 months.
Once a month.
Once a month, maybe.
Any other drugs? Street drugs?
No.
Sexual activity. How often? How many partners have you had?
3.
3 partners. Are you married?
Yes.
How long have you been married for?
2 months.
How long have you had this partner?
9 years.
Okay. So you live with your wife? Any children?
2 dogs.
2 dogs. Okay. Let's talk about your family history. Any illnesses that your mother or father have?
No.
They're still alive?
Yes.
What about your mother's parents, so your maternal side?
They are dead.
What do you know what they died from?
Cancer.
Both of them?
Yes.
Do you know what kind of cancer?
No. One had lung cancer.
Okay.
My grandpa had lung cancer. My grandma, I don't know.
What about your father's side?
Cancer.
Do you know what it
Brain cancer.
for both of them?
I don't know what my grandmother died from.
Okay. Any aunts or uncles that have any illnesses?
No.
Are they all still alive?
Yes. Most of them. Yes.
Okay. No cardiac history?
No.
Okay. What do you do for work?
I work for a transportation company.
Are you pretty busy?
Yes.
What kind of hours do you work?
I work a lot of nights.
Nights.
I work about 50, 60 hours a week.
It's a lot of work. Is that pretty stressful on you?
Yeah. That's why I get migraines.
Mm-hmm. Do you get enough sleep?
Yes. Try to.
Okay. What about your immunizations? Are they up to date? Have you had your flu vaccine or your shots?
Sure. They're all good.
Do you take anything over the counter? Any vitamins? Any supplements?
Yes.
You do? What do you take?
I take creatine if you include whey protein as a supplement, but I include it as a food source. So, whey protein.
Every day?
Correct.
Do you take any men's supplements?
I do.
Multivitamins?
I take multivitamins, fish oils, vitamin D3,
Okay.
vitamin C, BioGrow, which is bioactive peptides.
Wow.
That about does it.
So you stay pretty active?
Correct.
Do you exercise daily or weekly?
Yes.
How often would you say you exercise?
I try to make it to the gym 3 days a week.
3 days a
To
week.
4, depending on the season.
Do you follow any particular religion?
No.
All right. Let's talk about your nutritional status. So, how would you label yourself and your nutritional status?
Pretty healthy.
Pretty healthy.
I would say more so than most.
Like, what did you have for breakfast today?
Eggs
Mm-hmm.
with bacon. Yes, bacon can be healthy if it's 80% less sodium.
Mm-hmm.
With Ezekiel bread.
What is Ezekiel bread?
It is a grain.
Okay. What did you have for lunch?
That wasn't so healthy. I had stromboli.
Pizza.
Yes. A lot of vegetables in it.
Mm-hmm. Traveling. Have you done any traveling outside the country lately?
No.
Okay. Do you have any siblings?
Yes.
Yes. Are they relatively healthy?
Yes.
Okay. All right. So now we're going to assess his mental status. So what is today?
11/10/2013.
Now I'm going to show you 3 objects, and you tell me what they are.
That is a sea turtle. That is an owl ornament. That is a glass globe object, also known as a paperweight.
Okay. Can you tell me the difference between these 2 things? A steamboat and a rowboat.
Yes.
What are the differences?
A steamboat is operated primarily by a combustible engine, also operated by steam. A rowboat is usually operated by human strength or arms, such.
Okay. Very good. Can you tell me your mother's maiden name?
Yes. Wanda Singleton.
Also, can you repeat these numbers after me? 7,
7,
4,
4,
8,
8,
9,
9, 9.
Can you repeat those numbers?
7, 4, 8, 9, 9.
All right. What were those 3 objects that I had showed you earlier?
A sea turtle, paperweight,
Mm-hmm.
without looking. The other one was a owl paperweight and a glass globe paperweight.
Okay. Can you repeat those numbers I just spoke to you?
7, 4, 8, 9, 9.
Good. All right. I just have a few questions about how you feel your health is. How do you feel like your skin is? Do you have any dry patches on your skin? Do you have any unusual moles or rashes?
No.
No problems. How do you feel that your hair is? Do you feel like you're losing any hair? Do you have any concerns?
I'm balding.
You're balding.
I think that's pretty normal. When I was like 15, it started thinning out.
Okay. Do you notice any gray hairs or brittleness? You feel
No.
it's pretty healthy?
Yes.
Okay. Your nails, how do you feel like your nails are? Any weird?
Pretty good.
Any issues? Fungus? Any brittleness? Okay. Do you notice any swelling around your neck or in your groin?
No.
Okay. What about your head? Do you have any problems with your head? Do you have any swelling besides your migraines?
Nope. Just that.
Okay. Any pain in your neck?
No.
Any blurred vision?
My wife's a pain in the neck, but no blurred vision.
Okay. What about your ear? Do you feel like you have good hearing? Any ringing? Any
No.
pain? Do you have any issues with allergies? Your nose? Any drainage?
No.
No chest pain?
No.
No coughing?
No.
Okay. Do you ever feel sweaty or short of breath?
No.
Do you ever notice any unusual blood vessels or bruising?
No.
How do you feel that your muscles are? Do you have any soreness or
Just after a serious
irregularities?
weight training.
Okay. Any concerns?
No.
Any issues with your back?
No.
Any of your bones, your knees, your wrists, your elbows?
No.
No. Okay. All right. All right, now we're going to assess your skin. Now I need you to take off this top layer, sweatshirt. Now we're looking at the skin, we're looking at its color, its temperature. Is it cool? Is it warm? Is it hot? We also are looking at its moisture. Is he diaphoretic? Is there any sweating going on? He has pretty healthy skin. It's warm to touch. I don't see any abnormal growth. He has good skin turgor. Sparse amount of hair growing. I'm going to look at his back. Can you set up for me? We see some discoloration on his back. Looks normal. No rashes. No skin breakdown. Now while he's up, I'll look at the back of his neck. Pretty warm, same color throughout. Going to look at the legs. Normal hair growth, even, and bilateral legs. Take your shoes off. No rashes, no skin calluses on his lower extremities. Even hair growth. Are you having any difficulties with your skin? Any rashes on your face?
Mm-mm.
We're going to look at the face. Look for any rashes as well. Don't see anything.
I am promoting No Shave November.
And No Shave November.
Yes.
It does have hair growth here. Now we're going to look at the nails. His nails are clean. They are trimmed. They are not brittle. They are pink, within normal limits. We're going to look at your toenails. All his toenails are intact. They are pink. They are trimmed, even, no brittleness, healthy nails. We also are going to look at his hair. We're going to inspect it. Nothing abnormal in the scalp region. We're going to feel the hair. It feels light brown to dark blonde, not brittle, healthy feeling. Eyebrows. And that concludes our skin, hair, and nails assessment. Now we're going to inspect and palpate the lymphatic system of the head, neck, and clavicular area. He did not have any obvious deformities or swelling in the head or neck, but we will actually feel and palpate because sometimes you cannot see them visually. First, we'll have the patient sitting up straight, and we'll palpate the occipital nodes. I don't feel any swelling at this time. Then we will move to the postmandibular nodes. They're right here. I don't feel any swelling. We will move down. I know you just had your wisdom teeth taken out, so I'm going to palpate very smoothly. I don't feel anything. Now we will move down here. Don't feel anything. Down the neck. Even, no swelling or nodes. Now we'll have you sit up, straight. Put your hands together like this. Going to palpate that clavicular area. I don't feel any nodules. Now lift one arm up, please. Down this side. Feel in the face. Other arm. Even. Okay. The patient did not feel any tenderness on those areas or complains of any tenderness on those areas. Next, we will observe the head. We'll look at its position. It is symmetrical. He doesn't have any tenderness. He does have more swelling towards his cheek region, but that's normal for having your wisdom teeth taken out. It looks circular, no deformities, no lesions. I don't feel any. Do you have any tenderness?
No.
Tenderness here is the only spot. Okay. Now we have the arteries in the temporal region. I don't feel any brute at this time. Let's see if I hear any. Yeah.
I don't have to breathe in and out.
No. All right, now I want you to turn your head to the right. Okay, up and down. Any pain or tenderness?
No.
Okay. He has good range of motion on his neck. That concludes our head and lymphatic system. Now we will assess his eyes and eyesight. First, you are going to look at the symmetry of the eyes. Is there any swelling around the eyes? Are the eyebrows symmetrical? There's eyelashes. You can close and shut your eyes. Right? No swelling around the lacrimal glands. No swelling around the orbital muscles. They are unison and bilaterally moving. All right. Now we're going to look at his reflex. Okay. If you'll look past me in a distance, it's going to have you look up. Look past me. Okay. They are reactive to light. They are about a size 3. Now Well, Justin, do you wear glasses?
No.
Have you ever worn contacts?
No.
Have you ever had any vision issues?
No.
Okay. I'm going to have you read this chart. I want you to read the bottom line. I'm going to step 20 feet back. And I want you to look at with both eyes. Read the smallest line that you can read. Can you read this line down here?
Yes.
From this side to this side.
DEFPOTEC.
Okay. I want you to cover up your right eye. I want you to see if you can read the same line.
DEFPOTEC.
Okay. Now the left eye, cover it.
DEFPOTEC.
Okay. So he read the smallest, which is at 20 feet, reads 20/20. You have perfect vision, Miles. All right. Now I want to look at the muscles. I'm going to have you cover up one eye.
Oh, these muscles? Oh.
This eye. Okay. Now, tell me when my fingers disappear. Look straight at me and tell me when you still see them?
Yes.
Okay. My fingers?
Yes.
Still see my fingers?
Yes.
Tell me when they disappear.
Okay, they're gone.
Tell me when
Gone.
Right here? See
A
them?
little further. Now they're gone.
Okay.
Gone.
Tell me when they're gone.
Now they're gone.
Okay. Patient has equal peripheral fields and using all 6 muscles. Let's cover this side. All right, tell me, look straight at me, at my nose. Now tell me when these fingers disappear.
Gone. Gone. Gone.
Right here?
I can see them. Still see them. Now they're gone.
Okay.
Still see them. Now they're gone. Gone. I can see them. Yep.
Are they gone?
Well,
Still see them?
now they're gone. I can still see them.
Okay. I don't see any nystagmus, equal movement in all 6 muscles. His irises look equal. His pupils look equal. Move them from side to side. I want you to look over here. Look over here. They're bilateral in movement. Up, down. Okay. But yeah, no nystagmus present. All right. Now I'm going to look at his eyes. I'm going to dim the lights a little. Turn on the light. All right, I want you to look at an object past me. Okay, I'm going to start at 0. Red reflex is intact. I'm going to slowly go forward, keep looking in the other direction. I don't see any objects in the retina equal
There's a lot of air in there.
air. Now we're going to look at the other eye. I didn't see any obvious blood vessels. I want you to look past me. No, look at me, but look past me, please. Red reflex is intact. I don't see any obvious deformities or vasculature or macules. There's clarity, and distance is appropriate. That concludes the eye evaluation. Now we are going to assess his ear, and his inner ear, and his hearing. Now, Miles. His earlobes look symmetrical with his face when he looks at me. His outer ear has no swelling or tenderness. It looks symmetrical and even, filling all kinds of the ear. Any pain or tenderness in the ear?
No.
Okay. Now I will use when gently, with my right hand, I will lift his earlobe or his auricle and gently put it into his ear and visualize his inner ear. I don't see any redness or swelling or any deformities. I see the eardrum looks intact. No swelling. Let me look at your other ear here. With my left hand, gently lift up. No swelling with this. I see his inner ear. The ear canal looks clear. I don't see any deformities at this time. Now we are going to inspect his nose and his sinuses. Miles, can you look up at me?
Yes.
His nose looks symmetrical, no swelling on one side, no deformities on the nasal bone. We're going to palpate the sinuses. No tenderness right here.
No.
Okay. Going to look at the nasal passages. I don't see any deformities or swelling. Do you have any problems breathing?
No.
No. Okay. That completes the nose and sinus part of the video. Now, as I wash my hands, we are going to inspect Miles's mouth, looking for any deformities or issues. Now, this is the reason why he came in today. So this is a very important assessment. We are going to visualize his mouth and his lips for a correct color. They are pink, they are moist, they are intact. I want you to open up for me. We are going to visualize his teeth. I see some swelling and some bleeding. I don't see any clots at this time. I see some dental cavities in the upper two. Can you stick your tongue out? I know this is in pain. Okay. Going to look at the throat. I don't see any deformities. The uvula is in place. Smile for me. We got some swelling in the lower bottom portion of his mouth, and stitches are intact. No bleeding present at this time. Okay. I'll go. The gag reflex is intact at the same time. Now we are going to look at his chest and his lungs. I'll have you take off your sweater for me. So we are looking for any bruising or obvious trauma first initially. I don't see any. Will you take off this shirt for me as well? I need to see. Turn towards the camera. He looks even. We are looking at his spine. It looks even in the middle. I feel for his ribs. Tap. Looking at his chest. His trachea, look at me, is in the middle. No deviation. His ribs are not barrel chested. Broken ribs, no tenderness or pain at the apex. Now I will auscultate and listen to his breath sounds, starting on the upper left lobe. I hear clear. Going over to the right lobe. Clear. Now under. He sounds clear. Going on this side. Clear. And the lower right lobe. Clear breath sounds. Okay. Now sitting up for me. I'm going to percuss. Going to listen for voice resonance. Take a deep breath in for me. Clear breath sounds. And one more time. I don't feel any crepitus or any deformities. I see equal chest rise and fall with his respiration rate, which we did heard vital signs earlier. His respiration rate is about 16 times per minute. I didn't hear any high-pitched noises. So set up for me again. And repeat the word 99.
99.
99.
99.
It's equal. No high-pitchedness. I heard clear breath sounds. There's no vibration. There is vibration when he does speak. And no stridor, which is very important. Now we're going to do the heart sounds and heart assessment. First, we want to feel for a radial pulse and a carotid pulse. Okay. Now we want to check the size of the heart by placing the hand right here and right here. I don't feel any brute or thrill. Now we'll auscultate. Listening for the heart rate. Don't breathe in, just a moment. I hear the apical pulse. Hearing S1 and S2. No murmurs or extra heart noises at this time. I will also auscultate the carotid. The abdominal aorta. The renal iliac. And the femoral artery. I don't hear any abnormalities or any root or any unexpected findings at this time. Now if you'll recline, I'm going to inspect the patient, their jugular veins. They are not protruding. I don't see any pulsations. The temporal, which we already auscultated, I don't see any rhythm or protrusions. I'm also going to feel for the radial pulse. Good cap refill, less than 3 seconds. Good cap all throughout the body. No cyanosis. I'm also going to feel, he has pants on, but you can feel for the popliteal pulse. And the pedal pulses. There we go. One right behind the ankle. And feel that as well. Good cap refill in the toes, good color. No varicose veins. No abnormal veins in the legs. Minimal scarring on the skin. No varicose veins on this side. I do see, without using a tourniquet, some veins, but they don't look abnormal in color. There's a spot here where he has a little bit of bruising from the IV site from the surgery on last Thursday. Now we're going to look at his hand and his hand flexion. Can you do your hand like this? Pain or tenderness? Okay. Same side. Pain or tenderness. Now put your hands like this. Good. Move your hands back and forth. No pain. I'm going to feel for the bony prominences on the hands. No swelling or tenderness here. What about here? No pain here? No? Okay. Same thing on this side. Shrug your shoulders. Now shrug your shoulders. No pain there. Okay. Now we're going to look at his knee joint. If you have any issues, you want to gently raise the hand like this and gently move the leg. Any pain? Want to go out? No abductor. Okay. Bend your knee up. No pain there. Okay. Let me pull away. No, I don't see any give. Same thing for the ankle. Good rotation, no pain or tenderness. So we already have assessed some of the cranial nerves. We have started with 2, we did the optic, 2 and 3, 4 and 5 were all optic nerves. He was able to move his eyes up and down, no drooping of the eyelids. Now I'm going to check his olfactory, which is cranial nerve number 1. Close your eyes, Miles, for me. Close your eyes. What do you smell?
Wine.
Keep your eyes closed. What do you smell now?
Nothing.
That's right, it's water. So his olfactory nerves are intact. Now we are going to do his five, which is his muscles. So we want you to smile for me, real big. Okay. Now move your tongue side to side, up and down. We already have inspected his mouth, his uvula. They're all intact and equal. His eyebrows, raise your eyebrows for me. Frown for me. Okay. And his hearing is intact. We will also look at, we know that his trapezius muscles are intact because he can tug his shoulders up and down. He can move his arms and legs with equal strength. And his mouth can move equally. His speech is normal.
Yes.
His hearing is intact.
Yes.
And that concludes the cranial nerves. Now, during the assessment, we have tested a lot of his neuro deficits, which have been none. We have also looked at his movement, body movement, response time, hearing, all throughout and in the beginning. So neuro is kind of done throughout the assessment. But also, we will look at his response to things, that he his feeling sensation. So, Miles, I want you to close your eyes. Tell me if this feels different. Did those feel different or the same?
They felt about the same.
Okay.
The left one felt harder.
Harder. Okay. That feel the same?
Yes.
Okay. Am I touching your right leg or your left leg?
Left.
Am I touching your right leg or your left leg?
Either.
Okay. That is intact. He has 2-point discrimination. Now, hold your hand out for me. I'm going to draw a number on it. I want you to close your eyes and tell me what number it is.
7. 9.
No. Draw it again.
One more time. 8.
Yes. Okay. How far is this from this?
1 inch.
If close, is this from this closer?
From what?
From this to this. Is closer than this to this?
The first one is closer.
Okay. How about from here to here? Is closer from here to here?
The second one's further.
No.
The first one's further.
Yes, correct. Okay. Now, earlier he was able to identify these objects. Do you know what they were, Miles?
Yes. The owl and the sea turtle.
Yes. Now for the reflexes. The abdominal reflex is done by going upwards to see if the umbilicus moves towards the reflex and downwards for the lower abdominal, which were positive. Also, we were going to look at the Babinski reflex, and that's what the shoes off. foot this way. Have them relax their foot. And take your tongue blade. And you should not have any fanning. Okay. Now to do the knee reflex, I want you to hang your knee up to the side for me. Good. Positive reflex there. Now we're going to look at that's positive as well. Also going to look at your elbow. Relax the elbow for me. Okay. And then you're also going to look at, okay. Now I want you to hang your arm like this. Good. Positive reflex this.
Me for that one.
Put right there, that's fine. Now I'm going to test for clonus. This should not be a positive test. You want to push, can't see on the camera. Okay. And there should not be any tremors. Good. Going to test the abdomen. Palpate for any tenderness, no distension. Going to auscultate all four quadrants. I hear abdominal bowel sounds. Going to palpate and see the liver. I don't feel any swelling from the spleen or the liver. No distension. No pain or tenderness, correct? Now deeper palpation. Does not reproduce any pain at this time. Now are we complete with the portion for miles? I will continue to tell you about the other assessments. Thank you.
Thanks.
Now we are going to test the Romberg test for balance. And have the patient stand up with their hands to their side. And this patient has no issues with balancing on their own 2 feet. They can turn around and maneuver just fine. No shaking. It's intact. For the breast exam, you want to have the patient take their shirt off and bra. If it's a man, then not a bra. You want to observe bilateral breasts to see first for equalness, symmetry, if there's any swelling, if there is any abnormal bruising. You want to look at the areola. You want to look at the nipple to see if it's inverted. Is it circular? Is the color of the areola different than the rest of the breast? Is it darker pigmented? Is it abnormally large? Is it abnormally small? You want to see if there's any bumps or bruises or hair growth. Then you want to palpate the breast, starting in different manners. You could do clockwise from the 4 quadrants. You can go up and down in that form, or side to side. But it needs to be the same way you do all. You also want to view the breast in different positions. Sitting up straight with the hands to the side, with the hands clasped. Look at it that way. You also want to look at the tissue under the armpit and under the breast. You also want to do the same while they're in the laying down position to see if you can see any abnormalities or lumps. What you are really looking for are lumps, inversions, puckering, any hardness in the breast. Now for the female genitalia exam, you want to look at first the patient in a lithotomy position, lobotomy position. You want to look at the pubic hair. If it is sparse, it is congruent in color. If it is abnormal, the hair growth is equal. You want to look at any swelling, redness, drainage. The labia is intact. You want to look and see, feel for the glands. You also want to see if there's any pain or tenderness or color. Next, for the internal vaginal exam, you'll use a speculum, insert it with lube, and insert it as angle, change it. There's very different speculums you can use. It depends on the physician. After that, you want to look at the cervix, view it, see its color, its size, is it abnormal, and is there any drainage. You want to swab or take any specimens that you need to take out. Then next, if you have to do a rectovaginal exam, you want to palpate the posterior part of the vaginal cervix to see if there's any lumps. Is there any cyst? Do they feel equal? Next, for the bimanual exam, you want to look at, feel with your 2 fingers and then the other 2 fingers on the ovaries. Feel for pain and tenderness, of course, and for any abnormalities on either side. For the male genitalia, you want to, the same, look at the pubic hair, look to see the color, is it symmetrical. Next, you want to look at if there's foreskin, pull it back. You want to look at the urethra, is there any abnormalities, is it in the center, is it asymmetric. You want to look at the meatus, is there any discharge. Palpate the penis for any tenderness. Is there any abnormalities in its shape? And then also ask the patient if they have, because they know their body better than we do, any concerns. Next, you want to inspect the scrotum area for any you want to be symmetrical, of course. Is it reactively swollen? Is there unusual thickening on one side or the other? Do you notice any lumps? You want to palpate the scrotum to see if there's any abnormalities. Are they equal? And note those 2 things. Next, you want to use transillumination to see if there's any masses and to see if you can see any herniation on the inguinal areas. You also want to palpate the testes, the epididymis, and the vas deferens, which is underneath, to notice any tightness or abnormalities. You want to note the size, the color. Is there any nodules? Next, the prostate or rectal exam is important because you want to view any tenderness, or the prostate can also be palpated. It was one of the most important things. You want to look at the area for any tenderness or hemorrhoids at the same time, because that can be very painful when doing a rectal exam. Look at the sphincter. Is it very tight? Is it irregular? Or they look symmetrical in color? Those are very important things with all examinations. You want to look at the prostate gland, which you can feel. Should be not boggy, should be not too tight. It should be just palpable enough to feel. You want to know the position and test any stool at the same time for a guaiac. blood in the story.